We are now moving on to our last session prior to the Q&A. There's been a number of questions coming through chat about how people can reach and receive this webinar series, which will continue to reinforce throughout this webinar. Is all of this will be made available through Colorectal Cancer's YouTube channel, through both the OPTIMISTICC website as well as the Grand Cancer Challenges websites in approximately about a week or so. You'll be receiving communication as a participant in this webinar on how to get to those links. So please stay tuned for more information on this, and know that all of this information, this wonderful information, will be available in about a week or so. I'd like to now bridge into our final session, and please help me welcome Kimmie Ng, and a very big second welcome to Marielle Santos McLeod, who you saw earlier in one of the sessions. In this final session, we'll be exploring early age onset colorectal cancer in the microbiome. Dr. Ng is Associate Professor of Medicine at Harvard Medical School and the founding director of the Young Onset Colorectal Cancer Center at Dana-Farber Cancer Institute. She's also the Director of Translational Research in the Center for Gastrointestinal Oncology at Dana-Farber Institute. Marielle was introduced to us in work package number 3. She's back again with a young onset stage 3 colon cancer diagnosis in 2017. She's become a very strong force and patient advocate as part of the OPTIMISTICC program. Together, Kimmie and Marielle will discuss the interplay between early age onset colorectal cancer and the microbiome.
So welcome everybody to our discussion today on early age onset of colorectal cancer and the microbiome. We're going to discuss a whole host of subject matters dealing with early age onset, including some clinical trials going on and the work by Dr. Ng and the interplay of our patient researcher, Marielle McLeod, in Project OPTIMISTICC and the work of Dr. Ng. So welcome to both of you. Dr. Ng, could you tell us a little bit about the goals of your work in early age onset of the disease?
Sure. So as many of you know, colorectal cancer is a large problem. It affects many people. It is one of the most common causes of cancer and one of the leading causes of cancer death. Although overall incidence and mortality from this disease has been declining, unfortunately, that improvement has not been seen in people under the age of 50, where at least in the United States, since the mid-1990s, rates of colorectal cancer have been increasing by 2% per year in both men and women steadily as time goes on. And this trend is mirrored in many other countries as well, including Canada and many parts of Europe. Because we started seeing more and more young patients in our clinics with no obvious risk factors for the disease, we started to wonder, what are the underlying causes? And we also noticed that young patients have unique challenges when they face a diagnosis of colorectal cancer at such an early age. And so with that, we decided to launch a multidisciplinary center dedicated to the care and research of young patients with this disease. So our Young Onset Colorectal Cancer Center here at Dana-Farber started in March 2019, and we have a threefold mission. The first is to provide multidisciplinary, excellent, compassionate care to every young patient with this disease. The second is to actually raise awareness and education among the general public about the signs and symptoms of colorectal cancer and the importance of screening, as well as the health professional community so that they are also aware. And then the last is the research to really get scientists and epidemiologists and laboratory researchers together with clinicians who are caring for these patients to really elucidate what the underlying causes and risk factors are so that we can use that knowledge to develop new strategies for prevention, early detection, and treatment.
Dr. Ng, how does the care at the Dana-Farber Young Onset Center differ from a young onset patient going directly into just like a regular community cancer center?
There are many different ways that it is different because we do have a dedicated center specifically focused on patients with young onset colorectal cancer. As you know, as an oncologist, we're so busy figuring out the chemotherapy, trying to get the port in, doing the patient consent, that sometimes, very tragically, other extremely important things like fertility preservation, like psychosocial support, get left behind. And those parts of a patient's care are so critically important, especially if you're young, especially if you have a young family with all the different things that a young person is going through in other aspects of their life. And so as part of the Young Onset Colorectal Cancer Center here, all of that is addressed right from the get-go. None of it is missed. And we have a whole multidisciplinary team that is involved in caring for every aspect of that patient's cancer experience. On top of that, every single young patient is able to get their tumor molecularly profiled. And we do know that although every metastatic patient with colorectal cancer should have this done and it's covered by insurance, at least in the United States, it isn't necessarily for early stage patients with stage 1, 2, or 3. And sometimes the interpretation of those reports is not as nuanced as it could be. So here we also have every report reviewed by a molecular tumor board that then makes matches to off-label therapies or clinical trials to better deliver personalized medicine for every patient. So those are just a few examples of how it's different to receive care at a dedicated young onset colorectal cancer center compared to the community. But there are very many excellent oncologists out in the community that do deliver top-notch care. And often they can supplement that by seeing us or taking advantage of some of the resources that we have available for the entire community online.
Oh, that's really interesting. And, often as patients, we know a little bit more about the clinical side because we receive the treatments and we're in the hospitals and we're speaking the same language. But working on the research side, it's a little bit different. The language changes, the goals change slightly, and of course, the long-term picture is very much in focus. Can you tell us a little bit about your work with the other researchers as well at Dana-Farber and elsewhere around the world on the microbiome and how that might impact both prevention and treatment, screening and treatment of colorectal cancer as it really applies to young patients?
Absolutely. So as I had mentioned, the cause of young onset colorectal cancer is not currently known, but we do believe that it's environmental factors that are likely at play. And we know that environmental factors such as diet and lifestyle can greatly shape the microbiome, which is the community of trillions of microorganisms that are in all of our bodies and that predominantly live in our colon. And so one of the major hypotheses that we have is that it may be differences in the composition of the microbiome that may be leading to why young onset colorectal cancer has been increasing in recent years. And so the goal of our research is to better understand the role of the microbiome in young patients compared to older patients, and then compared to healthy young people who have not developed colorectal cancer. So part of the way that we are trying to accomplish this is with this microcosm cohort that is an important part of the OPTIMISTICC research project. And what microcosm is it's an international prospective cohort study that aims to enroll 2,500 patients with colorectal cancer, no matter what age they are, and to comprehensively collect data throughout time to better understand how the microbiome is contributing to the development of the disease in young people and older people, but also how the microbiome may be impacting the effectiveness of treatment, including immunotherapy, as well as chemotherapy, and very importantly, how it may also be influencing side effects from these treatments, because we do believe that the microbiome has significant impact in all these various areas.
Marielle, you've been involved in a number of the research projects with Dr. Ng for some period of time through Project OPTIMISTICC, and you work as a with a patient organization as well, with Colorectal Cancer Alliance, and as an individual patient who had colorectal cancer yourself, how has this research impacted you working together on this project?
It has been greatly impactful in regards to learning about all the incredible research that has actually taken place to be able to find appropriate, not just appropriate treatment for patients, whether they, regardless of their age, but also to the heavy community that is becoming very, very more impacted and affected by colorectal cancer. The research that we've done with Dr. Kimmie Ng, I have very much enjoyed, because it also takes into account the patient perspective and the patient experience, which is a really, in my world, it's a really big deal, because you're actually giving the patient a voice. You're gearing your information that you're providing to, the landscape in which you're trying to impact, information in which they can understand and comprehend, and make this disease a lot more digestible by all, so that everyone can raise their awareness and be more mindful of not just their environment, but that, in their health choices as well.
What do you think about encouraging other patients to participate in basic research?
Speaking from my own personal patient experience, knowledge is power. Being able to know the specific types of research, especially on the patient advocacy end, how I can bring this information to the patients and caregivers and other medical providers that we encounter on a daily basis, and let them know that this is happening. One of the things that I like about the microcosm cohort that I'm currently participating is that it's not one specifically demographic. With all of the various countries in which are participating in this cohort, we don't have one specific type of race or ethnicity per se, and not just one specific age group. We're looking at the data overall and how it impacts the entire colorectal community. So that way our research is a little bit more valid when I turn around and I present it to my colleagues in other facilities and other patients and caregivers in any capacity.
Yes, and of course the translational part is so important. Being involved in translational research really makes it real for those people who don't have that opportunity when you do explain it, to other patients and to caregivers and so forth. How has working together, Dr. Ng, with a patient researcher impacted your work? I know as a clinician, you obviously see patients in a little bit of a different context, but working together with Marielle and other patient researchers, how's that impacted your work and those who work in your lab as well?
So I have to say it has been absolutely critical to the success of this project to have a team of strong, intelligent patient advocates who have been giving us their input throughout, from the very early stages of study design all the way through implementation, and hopefully through analysis of results once we have them. Prior to this, I have worked with patients before. As you said, I care for patients with this disease. I've also interacted with patient advocates in the National Cancer Institute steering committees, where they have huge input into clinical trial design. But as you mentioned, Barry, this is one of the first projects where there was a formalized patient advocate program that was involved from the very beginning in designing a basic and translational research project. And what that has benefited us in, how it has benefited us in the most impactful way is that their voice was so important in helping us to understand how to implement the research. They were able to give us input on when was the best time to be approached about a research study? Was the diet and lifestyle questionnaire that we designed in terms and language that patients could understand? Is it too long? Is it better to fill it out on paper versus online? And these are critical aspects of a study's design that will ensure its success. So without involvement of Marielle and all the other patient advocates in our project, I don't think we would have been able to get to the point where we are now, with over 500 patients already enrolled in this cohort from many different countries. So, I think going forward, I will always have a patient advocate involved from the very beginning stages of my research.
I think that's a true statement of the benefit of Project Optimistic and your work in microcosm as well. That's really delightful to hear. Let's just ask one bonus question, if you will. What should we say to other patients who may be diagnosed with early age onset, some of them in their 20s and so forth? What type of hope can we give them from the work that's being conducted now in terms of treatment and also for prevention for, hopefully when they have children going forward? What can they do to prevent them from having the same experience?
Yeah, it's just been absolutely devastating for me to see more and more young people in their 20s and 30s being diagnosed with this disease. The United States Preventive Services Task Force, as you know, did recently lower the age at which to start colorectal cancer screening to age 45. But clearly that does not help all of our patients who are in their 20s and 30s. I want to reassure all of them that we are very much aware that new strategies are needed to detect the cancer earlier in that population. And I think the key here is to understand what the risk factors are, what are the underlying causes, exactly the work that we're trying to do here at the Young Onset Colorectal Cancer Center at Dana-Farber. Because if we know who is at higher risk, we would know who to target earlier for screening, no matter what age the guidelines say. And so I do think that that will be the key to helping that population prevent and detect earlier this disease.
So Dr. Ng, I know you've been involved in a project called Count Me In. Can you tell us a little bit about that project and how it might apply with respect to early age onset patients?
I would love to tell you a little bit more about it. So as you may know, one of the challenges of doing research in young onset colorectal cancer is that although the numbers of young patients are increasing, the absolute number is still relatively small. And in order to be able to answer some of the questions about the role of the microbiome or the role of diet and lifestyle in the development of this disease, as well as how it impacts treatment, we need thousands and thousands of patients and specimens with young onset colorectal cancer. And so it is critical that centers work together directly with patients to be able to accomplish and accelerate the pace of this work. And so Count Me In is a nonprofit organization that is aiming to do that, to directly partner with patients no matter where they live in the United States and Canada, and to do everything involved with research of this disease directly online. So it is a digital social media platform where the informed consent is done online, sending in specimens like your saliva, a cheek swab, your blood, or stool sample is all done online. The Count Me In team will request medical records and tumor samples, and there's also a comprehensive diet and lifestyle questionnaire that can also be accomplished online. And in this way, we really hope to speed up the pace of this work by partnering with more patients than just the ones that we are seeing in our individual cancer centers. It also allows people who don't typically make it out to these large academic cancer centers to be able to have the opportunity to participate in this research, and for us to be able to study a more racially diverse group of people where, in colorectal cancer, we know there are disparities, unfortunately, in the incidence and mortality of this disease by race and ethnicity. So we really need a diverse, broad patient population. And I do think Count Me In will help us to accomplish this at a faster pace. So if any patient out there with colorectal cancer is interested, you can go to joincountmein.org to sign up and participate.
I want to thank you both for a really enlightening presentation today. We're going to continue this conversation. This is just a little snapshot of our work going forward, of course, and we'll hopefully have the opportunity to do this once again. So thank you, Dr. Ng and Marielle, for participating in this research, this very important research, and for doing this webinar today.
Thank you for having me.
Thank you.
Many thanks to Marielle and Dr. Ng for that incredible session, which again shone a light on the importance of cancer care tailored to the unique needs of a young onset colorectal cancer patient, and some of the very fine work that's being done at Dana-Farber, particularly in terms of employing early molecular profiling, fertility support, some of the very unique needs of that population. A reminder too that Dr. Ng is part of the OPTIMISTICC project. She's a co-investigator on work package number 5 with Joseph's team to understand how some of the lifestyle factors shape the composition of the microbiome and those who develop colorectal cancer at an early age.